Some can be related to hearing. They may have hearing difficulty, and that could also cause a speech problem. But again, it's a diagnostic procedure. Take a look at the tongue. I tell parents, listen to the speech in the morning and listen to the speech in the afternoon. The tongue is a muscle. It's attached on one end by 8 muscles and one end by nothing. And that's where craniosacral therapy comes in, and myofunctional therapy comes in. You can have speech problems because the tongue is restrained, or you can have neuromuscular problems too. I mean, there are a lot of things that have to go into, but in a normal, healthy child, before I would spend an excessive amount of time, it's sort of like when I read on the internet, you know, I didn't have my baby's tongue clipped, and I went through 24 sessions of craniosacral therapy, and now he's doing fine. Okay. It's a simple procedure, and you can try to make compensations for it, but why? Why go through 6 months and thousands of dollars when it's a really non-invasive procedure, and it can be done quickly, and then get your myofunctional therapy, then get your craniosacral therapy. Now, there's another phenomenon which may or may not be real, which we're seeing more of, and that is when you have a posterior tongue tie, it might be a good idea to have 1 or 2 craniosacral visits prior to surgery, because some of the chiropractors I'm working with are saying after I release the posterior tie, a few weeks later another one develops. It's not really reattachment, but because you're loosening up everything, the rest of that frenum starts to elevate up. So the posterior tie may be a tie that's restricted and not showing itself unless you look at it the way I tell you. But then once I release it and make more flexibility and get some manipulations, it becomes more visible. And then I go back and I redo it a second time. And again, right now, we don't charge to redo it within the first 6 months. No reason why, I just don't feel that if we haven't cured the problem in the first 4 or 5 months, I'll just do it again. I don't charge that much to start with. I know people are charging $1,000 for each one, plus general. Before you know it, it's a $5,000 procedure. But again, it takes 2 minutes. But I would never use general anesthesia on my child for an elective procedure and run the risk. When I was in my residency, they put a child in the operating room because she had some disabilities to put braces on her, and she died on the table. So that, you know, an elective procedure that's virtually, I can think of no reason not to do it, or any kind of contraindication or complications done correctly. You don't need anesthesia. We don't use anything. I introduce no chemicals on the babies up until about, after 6 months, it depends on the size of the baby, as well as the alertness of it, whether I'll even know it. We have some topical, which is non-benzocaine. Sometimes we just use topical. Yes?
I'm just wondering, our son, when he was about 2, he had all 4 of his front teeth removed, and they were severely decayed right down, and they couldn't be saved. I'm just wondering if you've seen quite a bit of improvement with tooth decay.
If you read the article on my website, The Effects of Breastfeeding and Tooth Decay, if you have a tight maxillary frenum, and you're breastfeeding at will during the night, and that milk is pooling around the teeth and not being removed, you stand a good chance of getting facial decay. Now, it all depends on who you see, whether they can be crowned, but, or you just try to remineralize them with fluoride and chemical amylase. But there's no reason for an infant to lose their front teeth, because even if they start to decay, the physician should get you to a dentist in time enough to prevent it, intercept it, or correct it. The only ones that I see that I pull are the kids who have milk bottle decay, or there's been some nursing, but they're getting to me at 18 months of age, and that's the end of that. But I'll show slides tomorrow, and you'll see it's different. When you sleep with a bottle, the decay process begins on the lingual surfaces because the milk is pooling behind the teeth, and that's where they start to go. In an infant that's breastfeeding, with a tight maxillary frenum. So don't twist any words I say. Breastfeeding is not causing the problem. It's the maxillary frenum which is trapping milk and keeping it in contact. It doesn't matter what kind of milk, it's going to break down to lactic acid. And mother's milk does have sweeteners. It is sweet, there's sugar in it. And it may be a different form, but it still will cause decay if left in contact with the tooth. So that would be my diagnosis. Now, I had one mother, after her fourth kid, stormed out of my office. She said, people breastfed for 5,000 years and they never had tooth decay. And I said, that's because they probably died within 18 months. 5,000 years ago. How many babies survived? Who knew what tooth decay was? And my next comment was, were you there? That was the end of our relationship. Does that answer your question?
Well, I was just wondering if you've seen like a gross increase in the amount of...
You know, I'm not going to see an increase because my babies get their frenums cut in the first 6 months of life. And the first time I see kids is at a year. So they don't get to that point because I'll catch it in a year to restore their teeth if I have to. But before, if you go, the first article I wrote was 1979, and the only reason I caught it was a girl I had gone to high school with brought her baby in because she was tongue-tied. And they had decaying on the front teeth, and I had no clue. And while she's nursing, I said, let me take a look at something after the baby got done nursing. And I pulled the lip up, and there it was, milk all over the facial surfaces. It was very obvious at that point that that milk was being trapped and not allowed to escape. Now, if you nurse during the night 2 or 3 times, and that baby is keeping the milk there all night long, it's going to be pretty rapid. So I would say within 2 or 3 months of those teeth coming in, they're going to start to show white little marks. And it's another old wives' tale. Oh, it happened in utero, there's something wrong, my baby has soft teeth. I've never seen a baby, the upper front teeth decay, and the bottom teeth normal looking. Okay, unless they have something called dentinogenesis or osteogenesis defective. One thing which I don't lecture on is I did have a baby come in, failure to thrive, tongue-tied and lip-tied, and it was interesting because the baby had a vitamin D deficiency, but it was because the mother was a vegan and didn't have enough vitamin D, and her milk didn't provide the baby with adequate vitamin D. So because of her diet, her milk didn't have the nutrients in order to give that baby the nutrients. And it took the doctors a while to diagnose it. So that baby ended up on supplemental vitamin D because the mother didn't do it herself. Any other questions? If not, to me it's 10 o'clock at night. I'm ready to go to bed. Tomorrow, bright and early, we'll get started on time. And hopefully I'll answer all the questions. If not, as I said, since I'm the only one speaking tomorrow, we can make it very informal. I left my shorts at home, so wear long pants, we can make it very informal. We'll, as I speak, if you have questions, for most of the time, the only time I'll say let's wait is if you ask a question, which I'm going to answer later on. Then I don't want to jump around. My slides are in order. Okay, if not, then I appreciate you coming. I'm glad to be here. And it was good for me to hear both sides of the story. I'm just in the middle. So thank you very much. I'll see you tomorrow.
I just want to thank everyone who spoke this evening, and thank you, Dr. Kotlow, for coming all the way from Albany. We really appreciate it. Feel free to take a few minutes to talk to your neighbor or ask each other some questions, to tell each other some stories, and we'll see many of you tomorrow morning, and thank you so much for coming.